All right, let's get to Dr. Carfora. What are you seeing in your practice in the past few days and few weeks?
So in the past week, we've seen a rise in the Delta variants, a rise in COVID-19. But the good news here is early treatment and early intervention is preventing hospitalization.
So what kind of numbers? What kind of numbers are we talking about in terms of your patients?
So 38 cases in the past week, and I've had 2 cases where I sent to the hospital for monoclonal antibodies.
Okay, and so 38 cases, vaccinated, unvaccinated, a mix?
Yeah, majority are unfortunately vaccinated. So I think that we need to, vaccinated or unvaccinated, get early treatment. That's the message I really want to get out there. And we still need to protect ourselves.
Yeah, I do want to talk about treatment and prevention, but just to follow up on that, most of the cases were unvaccinated, which in a way doesn't make sense, right? Because if this Delta is so strong that it gets people vaccinated, then you'd think everybody unvaccinated would be getting it. That seems like a dichotomy there.
Yes, yes. I think what's happening is that the CDC is going by what hospital admissions are. So I spoke with a nurse on Friday, a local hospital, and said, how many vaccinated and unvaccinated people are coming into the emergency room for treatment or for admission? She said it's about 50-50. I'm seeing in my practice, again, I have a different practice. My practice is based on prevention. So a lot of my patients, again, they are vaccinated, but a lot of them also are using other modalities that are preventing illnesses so they don't wind up in the hospital. So I think we, again, the message is vaccinated or not vaccinated. Again, you have early treatment modalities. And if you get sick, contact your doctor within the first 4 days of this.
All right, so 2 quick things. First of all, you heard Dr. Fauci saying everybody who's unvaccinated should get a vaccine. Would you agree with that?
Well, you know, the vaccination has decreased from 91% to 66% in the RNA, the messenger RNA vaccines, which is Moderna and Pfizer. Now, those vaccines, this is the first time that they've been put in human bodies. Johnson & Johnson is more of a conventional vaccine, okay, which is like the influenza vaccine. So they went by conventional measures. So we don't have numbers on Johnson & Johnson. I'm interested myself to see that. But the messenger RNA virons, again, the vaccine is decreasing efficacy. But even though it went from 90% down to 65%, and some cases it says 45%, you still have to look at the positive end. You have 65% protection, where you have, so there's still protection, especially for the elderly and those at risk. Again, elderly and those at risk, like you said, people of color.
Okay, and this is certainly a true statement, right? That if someone's unvaccinated and someone is vaccinated and they get COVID-19, the unvaccinated symptoms are much more serious. That would be a correct statement in most cases, right?
In most cases, but I'm not seeing that. Again, we're going by numbers of hospitalizations.
Right.
What about the people that are being treated in their doctor's offices and never get to the hospital?
Right.
So we really have to look at numbers of positive testing compared to how many people are going into the hospital from how many people are positively tested.
Got it.
I think that's when we're going to get real numbers.